Most of the pediatricians would be familiar with scenario where parents turn up with their kids having viral febrile illnesses with the main concern that they are trying to control the fever either with one drug which can be paracetamol or ibuprofen or combining the two in form of alternating these medications every 2 hours, and they are worried that the fever is still high and it's not coming down. Now, this is a common error done by parents when it comes to combination antipyretic administration for febrile viral illnesses. Now, today I'm going to show you what the evidence actually says and give you a much simpler and safer approach that keeps these children comfortable for longer. So stay with me because this is genuinely important. So hello folks, my name is Dr. Syed Kazmi and I want to start by talking about something called fever phobia. Now, it's this very understandable but medically displaced fear that a high temperature is by itself dangerous, that it will cause permanent harm if you don't bring it down immediately and aggressively. This fear is why so many parents end up on these instances to our alternating schedules. They want to stay ahead of the fever. They want to feel like they are doing something, and I completely get it. But from a clinical standpoint, this approach creates more problems than it solves. So let me break down the two main strategies that parents use, and then we'll look at what the actual research says. The first approach, let's call it regimen 1. It's the strict 2-hour alternating relay, like paracetamol at 8 a.m., then ibuprofen at 10 a.m., paracetamol again at 12 noon, and so on and so forth. Every 2 hours you are hitting the fever with a different drug. So on the surface, well, it feels proactive, feels like you are in control. But in practice, it's a recipe for dosing errors and potentially an accidental overdose. The second approach, I would call it regimen 2, is what I call the evidence-based combined schedule. You give both paracetamol and ibuprofen together as a starting dose, and then you let each one run on its own proper clock. Like paracetamol every 4 hours and ibuprofen every 6 to 8 hours. No complicated relay, just two separate timers. And when you look at the pharmacokinetics of these drugs, that is the science of how actually drugs move through a child's body, the regimen 2 clearly wins. Yes, it clearly wins. So the question is, why the 2-hour relay is risky? Now here's the science bit, and I promise to keep it simple. Paracetamol has a half-life of roughly 1.5 hours to 3 hours in children. To protect the liver, you need at least a 4-hour gap between doses. Ibuprofen, on the other hand, has a slightly longer half-life and needs 6 to 8 hours to protect the kidneys and the stomach lining. So when you are dosing every 2 hours, you are giving the next medication before the previous one has even reached its peak effect. The drugs are stacking up before the body has cleared them. And here's the really dangerous part. In the fog of a sleepless night, it is incredibly easy to lose track of which drug you gave last. If you accidentally give 2 doses of paracetamol back to back on a 2-hour schedule, you are in an accidentally overdose territory. So the American Academy of Pediatrics, AAP, has specifically warned against complex alternating schedules for exactly this reason that I mentioned. They don't offer a proven benefit over 24 hours and they significantly increase the chance of a dosing mistake. So the question is, what does the gold standard evidence actually say? Now, there's a landmark study called the PITCH trial. This was probably done in 2008. It was a major double-blind randomized controlled trial and it tested a schedule almost identical to regimen 2. That is, give both paracetamol and ibuprofen together and then follow the proper 4-hour and 6-hour windows for them respectively. And the results of this study were remarkable. Children on the combined approach stay fever-free for an average of 2.5 hours longer. Yes, 2.5 hours longer on the first day compared to those taking ibuprofen alone. And it was 4.5 hours longer than those on paracetamol alone. So 2.5 hours longer as compared to ibuprofen and 4.5 hours longer as compared to paracetamol alone. Now, this is a huge difference in child's comfort and ability to rest, drink fluids, and recover. And crucially, there is no high quality trial evidence supporting the 2-hour alternating relay. Yes, none. So here's what I want you to take away from this. If the child's fever is causing significant distress and the pediatrician agrees that dual therapy is appropriate, here is the plan. What you do, you give the correct weight-based dose of both paracetamol and ibuprofen together to begin with. Then set two separate timers. One for 4 hours, that would be for the paracetamol, and one for 6 hours, that would be for ibuprofen. And ask the parents to write down every dose. It can be in the form of phone notes or fridge notepad or whatever works for them. The written log is non-negotiable. It protects the child. And that's it. Simple, safe, and actually backed by evidence. So, at the end, if this helped you, please smash that like button and subscribe for more evidence-based pediatric advice. I'm Dr. Syed Kazmi signing off. Stay safe and stay informed. Bye-bye.